I'm Anthony from OpenStax. I'm so glad to be here. We're so glad to have our authors. If any of you have joined the previous sessions this morning, we've been talking a lot about the extensive effort and time that went into authoring these resources and about the value of the specific books themselves. But we haven't really gotten into too much specifics about the books themselves, and this is the first opportunity in the summit to do that. So we're so glad to have Donna Paris and Tina Barbour-Taylor here to speak peer-to-peer about the pharmacology textbook. I just want to say a few opening remarks and then turn it over. But I'll say offhand that this session will be recorded. And it will be available on the OpenStax YouTube channel afterwards. We'll probably say that a few more times during the session or in the chat. If you do have any questions, you can put them in the chat, or if you have something more in the question arena, maybe put it in the Q&A. That's probably the easiest thing to do. And then we will answer. And it's kind of hard to present and answer at the same time. You've all probably experienced this. So, we'll try to gather at the end. If there's any opportunities and we do see the opportunity to answer a question along the way, we'll do our best. But otherwise, we'll ask them at the end. We'll answer them at the end. I see that Tina had to drop off for a second. Maybe she was having a problem with her camera, so we'll get that settled. One other thing, a couple other things we should mention. OpenStax is committed to the safety and accessibility of all learners and all attendees. So as part of that, we are making every effort to make the session usable in a lot of different ways. One of those ways is recording and distributing it after. Another is by providing live captioning. If you do need captions, at the bottom of your screen, you should see a link for captions, and you can turn them on, and it will do captioning after, as we're speaking. Again, because we're seeing a few more people pop in, we'll get started in just a minute. The session will be recorded. And we'll do our best to answer, questions about logistics and OpenStax stuff, technical items and things like that. We'll probably handle in the chat. You'll probably see Lindsay and myself answering a lot of those. If it's about, the books or how they could be used and Donna and Tina's vision for certain things, probably those are best. We'll kind of get to those at the end. So Donna, I know your co-presenter has dropped off, so I'm sure you're a very experienced teacher. You've probably been in this situation before. So I will however you want to go. Oh, you're on mute though.
Actually, Anthony, my biggest problem is I have a lot of lag going on.
Okay. Well, I hear you fine. So maybe it's me. It's probably me. It's how things normally are. So maybe I don't know if you're seeing it elsewhere, but you sound fine. I know it might be distracting. So
are you okay if I share my screen?
Yeah, please go ahead.
Okay.
And if the only reason we'll ping in is if you don't see and Tina is able to join again, I might just jump in and mention it. But other than that, I just want to say, Donna, before we really dig in, thank you for doing the session. Thank you for all your work on this book itself and for sharing. I don't know if you were on the earlier sessions, but hearing from actual authors about the books has been a very, very deep request from the attendees so far. And yes, we will share that recording also afterwards. So take it away, Donna. Thank you again so much.
All right. Thank you so much. I appreciate your introduction, Anthony. Can you see my screen that says Pharmacology for Nurses?
Yes.
Perfect. Well, I am one of the co-authors for this book. I do hope that Tina is able to join us here shortly. Pharmacology for Nurses is a book that's intended specifically for pre-licensure nursing students in some sort of an introductory program. I believe Lindsay mentioned earlier that it was appropriate to use these books for other types of programs, the ADN program, diploma program, and that kind of thing. It was written to provide a basic understanding of the therapeutic use of drugs so that the nurse can provide safe and effective care to clients. And so the text is going to give a brief overview of each body system before it reviews the pathophysiology of various disease processes and then the medications that are used in treatment. So the senior contributing authors are Dr. Tina Barbour-Taylor, Dr. Mueller, myself, and Dr. Dory Weaver. In addition, there were several other nurse educators, primarily those who had an expertise in teaching pharmacology at some point, PharmDs, who also co-authored various chapters in their areas of expertise. Each chapter went through rigorous editing and peer review. So as I mentioned earlier, this was designed for pre-licensure students as opposed to those who are in advanced programs. Specifically for an introductory program, it's to assist the student in helping prepare students for the NCLEX. And we really made, and every author did this, a focus on client safety. So it's our hope that Pharmacology for Nurses is going to give students the confidence to safely administer medications to clients, as well as provide medication education to various clients and their caregivers. We focused a lot on common client conditions, as opposed to those who were that are more rare. Skills orientation. We have special features about client teaching, and we did use a holistic approach in authoring the book. So in total, the table of contents presents about 40 chapter topics that are organized into 11 different units. So the first unit consists of 3 chapters, and it provides a very broad overview of pharmacology. And then the 10 following units focus on specific body systems. You can see that Unit 1, and we'll talk in a little bit more detail about that, Unit 1 discusses a basic overview of pharmacology. It does include some ethical considerations. We do have drug administration, a thorough discussion of drug administration, as well as quality and safety. Now, let me check a question that just came across.
Oh, did you see the question about dosage calculation?
That's what I was, it does incorporate dosage calculation problems. We incorporated not only the how to, we used dimensional analysis, ratio and proportion, and desired over half. And so each chapter includes 1 to 2 dosage calculations, and then chapter 2, which is the chapter that has dosage calculation instruction in it, we include not only the explanation, but we include review questions, and also we look at review questions that also cover dosage calculations. So we hope that this book will help students prepare for the licensing exam by offering applicable real-life content in very short, manageable sections. So it focuses on a lot of common client conditions that the nurse is going to encounter throughout their career. It embraces a skills orientation. In other words, what does the nurse do in this situation? The text presents information in a holistic manner. It ties the disease process to its pharmacological treatment. We include various case studies. Not all chapters have an unfolding case study, but most chapters have at least one case study, and some then will go ahead and include an unfolding case study. We hope that this approach will assist students in connecting the pathophysiology of the disease process to the actual nursing care of the client. So as you see, Unit 2 focuses on homeostasis. We include information on fluid and electrolytes, as well as alternative and complementary therapies. I'm sorry, I am having trouble getting there we go. Okay. Unit 3, I'll just let you read kind of the topics there that I have up on the slide. We do know that it's important for nursing students to comprehend not only the mechanisms by which drugs impact the body, but also how does the individual's body or physiological factors influence the drug's response. And so when we looked at this along with the discussion of each body system, we provide the pathophysiology of the disease process as well as the medications that are used in treatment. We know that pharmacology is probably one of the more challenging courses in nursing school, but we tried to present this information in a holistic manner that's going to tie the disease process to the pharmacological treatment. And we hope that this is an approach that will help students connect, again, as I've mentioned it before, the patho of the disease process to the nursing care of the client. Being an effective caregiver requires the nurse to have a solid understanding of disease process and allowing the proper assessment and treatment of the client. Due to the number of drugs that are used in clinical practice, we have used drug prototypes. And so it usually, while we mention other drugs, the drug prototype is the one where we put it forth in the chapter, and it's used as a representative. And we hope that that will help facilitate student learning. Some of the pharmacological features that we include in the text, we have drug emphasis tables. We have the drug prototype tables that I mentioned just a minute ago. Each chapter, when appropriate, includes some of the black box warnings, the FDA black box warnings, as well as various safety alerts. Dr. Taylor, do you have any other comments that you would like to insert at this point?
Hey, Dr. Paris, yes. As far as the drug emphasis table, we try to use those to focus on more broad drugs in the category, and then the drug prototype focuses on the one that can kind of carry over side effects that's succinct amongst all those drugs in the category. The FDA black box warnings, we follow the Daily Med FDA approved labeling for those, and then safety alerts are based on our Q-Thin competencies.
Thank you. So some of the nursing features, we have nursing implications sections. So if we have a drug such as metoprolol, and we know that that is a drug that decreases heart rate and blood pressure, we will have suggestions for the students that, okay, you should assess the patient's blood pressure before you give the drug, but you should also monitor the blood pressure after you give the drug, and the same for the heart rate. And so that's just one quick example that I could give you about nursing implications. We have client education boxes, and these are tailored specifically to the drug and the drug prototypes. We have various clinical tips throughout. I'm going to let Dr. Taylor speak more about that in just a minute. We've got special consideration boxes and various case studies, as I mentioned earlier. We also provide links to learning. And so that'll be a jumping off place for students that want to take it a step further. We have boxes like Trending Today. For example, I believe one of the sections I wrote, we discussed the cost of medications. And one of the links that I found to place in the book was the most expensive medication currently on the market. And so that's just one example that I can give you that was a use for Trending Today. We also did incorporate some off-label uses of the various medications. Dr. Taylor, do you have any other comments that you want to make on this particular slide?
Sure. As far as clinical tips go, those are basic tips that an experienced nurse might offer to a nurse that doesn't have as much experience, or something that we really want to point out for the students to take into consideration. And then as far as case studies go, I really love the way the case studies work throughout this book. We have some basic case studies on some of the chapters where some of the drugs really don't need to be explored in depth, but then we have unfolding case studies that follow a certain disease process and how certain drugs may be added within the category, such as a patient may come in with high blood pressure, and we watch at how those drugs may be added or transitioned based on the case study and the patient. And we do that also with our diabetes chapter. The links to learning are great. I found that students really love the links to learning because it kind of breaks up the text and it makes it more interactive for them. And they really like to see a different perspective versus everything that's in the book. It just makes it very interesting for them. And I think that's it, Dr. Paris.
All right, thank you. Let's see if I can't get my, okay. So the introductory unit of chapter 1 has a discussion about some of the interdisciplinary teams that we might see in giving medications, you might say. We talk about drug sources and forms, and we go over the generic brands as well as the brand equivalents. The difference between prescription and over-the-counter medications. We even discuss scheduled meds and that type of thing. The various drug classifications and special populations such as the elderly and the pediatric. We even touch a little bit on genetics. And so these are some of the things that are covered in unit 1 or in chapter 1. Okay. And then in chapter 2, we discuss drug administration, and we brought in the nursing process and the importance of assessing a patient before delivering a medication and then following through with that and how to do so. We also discuss nursing clinical judgment. And we really tried to take that towards the next gen NCLEX. And so that is discussed in chapter 2. We go into detail about pharmacokinetics and pharmacodynamics, and go into bioavailability and half-life and the important things of, as I mentioned earlier, what the drug does to the body, but what the body does to the drug. And then we discuss some of the various forms and routes of administration. And I really like that particular section of this chapter because each route of administration is covered, the advantages, the disadvantages, and actually the steps to giving that particular route. And we incorporate the safety mechanisms that go along with that. And so I think that the student will really find that helpful because if they go in to give a subcutaneous injection, then they have a step-by-step process where that's given, and it's a standalone process. So it can be incorporated as a whole within that chapter, but it can also be more or less a skills checklist, if you will. And then, as we've already mentioned and covered earlier, that we do have drug calculations in this chapter as well. For Chapter 3, we covered some various legal considerations. Again, we focused a lot on client safety. We want to prevent drug errors when possible, so that there's a fairly lengthy section about drug errors and what causes drug errors and then how to prevent them. Drug administration, various adverse reactions. And then we go also into a little bit about nursing informatics, and we address the cues and competencies as well. So at this point, what we would like to do is give you a brief overview of Chapter 18. And Dr. Taylor is going to kind of take it from here. I'm going to stop sharing my screen, Anthony. And
Okay.
are you still on?
I am, yes. I just went up.
Perfect. Okay, so I have stopped sharing my screen, and I'm going to ask Dr. Taylor to take over. And I don't know if she's prepared to share screen or if she would prefer you to bring Chapter 18 up.
I was hoping Anthony could bring Chapter 18 up for me.
Absolutely. Just give me 1 second. I will. I have the site here. I just gotta go get the PDF to come up, and then I will share screen in 1 second. Okay, so actually, let's take this all the way. Let me start. Share screen. Sorry, there. Okay, so just to take everybody through while we're at it, might as well get to how you get here in case you haven't seen this in earlier sessions, if that's okay. So basically, if you went to OpenStax and you went to subjects and then click nursing, you'd get to this page, and then you can click pharmacology, and then you could at this point download a PDF sample, and then you get to the book, and then I will let me get to Chapter 18. Just a little far. Okay. I don't know if let me zoom out just a bit. That works. Okay.
Okay, great. Thank you. So our end units of the book are consistent with system type conditions or pathologies that occur. And then it also focuses on medications or treatments for those types of condition. So Chapter 18 we used as our prototype chapter because antihypertensives and anti-anginal drugs are very common. We see it every day in the hospital settings as well as in outpatient clinics. So we wanted to start on a chapter that was familiar and try to fill it with as much depth as we possibly could and figure out what type of features would work within a chapter and what kind of really wouldn't work very well in the chapter. So as you can see with this chapter, we kind of start out with just a brief pathophysiology and explanation for the disease processes themselves. And then as we progress through the chapters, we start hitting on specific drugs regarding those medications. On this chapter, we also focused on specific populations because we know that some antihypertensive medications work with certain populations versus other populations. We focus on not only drugs themselves, but non-pharmacologic management for those types of patients. And then we really try to start to look at the different types of drugs. We covered the majority of the antihypertensive drugs, trying to make sure that they are very focused. And then at the end of the chapter, we include our NCLEX style next gen questions. And then those are mapped to the 2021 essentials. Some of the features that we focused on, again, was looking at those unfolding case studies throughout the chapter. so that we get the case study that begins and then it unfolds as the chapter goes, adding different medications or looking at the patient from a different perspective. There's also various link to learning that will actually link the students to more interactive avenues and activities that they can actually learn from, such as how to take blood pressure, because that's important. All nursing students and nurses should know how to do that. And then we kind of focus more on special consideration boxes and clinical tips for those students. Most of the chapters are laid out very similarly to this one. We tried to use this one again as a prototype for the rest of the chapters. However, you know, everything doesn't fit in a nice little shell. Some of the chapters didn't fit exactly with the antihypertensive chapters, and they had to be adjusted somewhat because not all the considerations would fit in there. Donna, did I leave anything out?
I don't think so. I think you gave a very comprehensive discussion of what to expect from the book.
I really like this book. And looking at other open educational resources, I think ours is a little bit different than theirs. We did have PharmDs on board who reviewed every drug that we covered within the chapters to make sure that they were accurate, as well as we went back through before the book was ready to actually go towards the publications, just to make sure that all of our daily med FDA resources were up to date, because those change quite frequently on their website. So we wanted to make sure that we had the most up-to-date information in this book that we could possibly have prior to getting it to the students. We also have our chapter summary and key terms that the students are if they did have a question about what something was, this would help. And they're also linked within the index of the chapter. So if the students go to the end of the book to the index, they can click on something and it will reference them back to the chapters where that keyword or that specific topic is covered.
I think it's a very user-friendly book.
And if I could just chime in one sec, thank you so much. And I know we haven't. I'm trying to follow along with what you're saying, but you know, as we've mentioned, you know, these books are available in multiple formats. So this is the PDF format, and some of the interactivity that Dr. Taylor was talking about, you know, clicking back and forth. In the online format, that's very clear. You know, there's a very distinct keyword section and everything clicked, very easily navigable. PDF has other benefits. You know, it's a little more visual. It's a little more, you know, traditional textbook. So there's always a trade-off, but you know, that ability, you know, we have linked things together and so on, so we can get it out. And I didn't click on any of the link to learnings, but you hopefully see them in there, that you can go from there to other places, and it will open a new tab, and you'll be able to kind of, your students will be able to keep an eye on where they started from in order to you know, to get back to where they started.
Yes, and one of my favorite things about the book is that we do cover alternate topics that you typically don't see in your normal pharmacology books. You know, we touch on the transgender section, which is really a great chapter. It's well laid out. It covers most of the drugs, but it's very culturally and diversity considered. So it's very, very good. And then also looking at our weight management chapter, since that is a hot topic right now, with some of the drugs, some of the new drugs that are out there that should be used for different disease processes that are now used for some of your weight management processes, and trying to look at that in a more culturally specific way.
I do think, I want to reinforce what Dr. Taylor just said, but I do think that we really tried our best to incorporate the cultural and diversity aspect throughout the entire book.
And then hitting on more of your specific topics across the lifespan, we do include some pediatrics. Again, this book is focused on adults mostly, but some of the chapters, such as our respiratory chapter, our immunization chapters, Our cardiac chapters, there are pediatric content in those chapters, as well as your diabetes chapters, because those are some of your heavy topics that are hit within pediatrics. It was a long conversation to determine which chapter should include some of this pediatric material. Then we also have our geriatric population, and then looking at different races and how medications and drugs affect those types of races and treatment. Does it require combination drugs, or is it more of a straight format for drug therapy for those types of patients? And looking at, maybe their geographic locations. I'm from the South, if you can't tell. So, we not all the time have a good diet. So, so a lot of times a lot of fried food and things like that, and how that impacts like heart health or your endocrine health. So we try to cover different geographic areas and things like that may be impacted throughout the book as well. Dr. Paris, do you have anything to add to that?
I don't. I think we've given a fairly good overview of the book and how it came about. I do want to stress that it was not only stringently edited, but it was also went through the peer review process. We've done our very best to make it as current as possible in regards to our links and that type of thing. And so I think that winds us up.
Thank you. I mean, I'll just say, not being a nursing faculty member or an expert in this field at all, but being sort of an observer and working with the team to help manage the process. What Dr. Paris and Dr. Taylor are saying about that interaction with people, there a lot of reviewing, a lot of comments, a lot of very conscientious consideration of those comments and reviewing, and as you probably everybody who's attending is probably, if you've written a paper or a chapter, you can spend hours on that one comment, that one, how are we going to wrestle with this? And I'd say this team really did it, and having all those expert reviewers, checking over the drugs, and still we're about to publish this book and we're talking about changes that we're making now, in the final edits and so on. So it really is a robust process. And I thank you both for undertaking it, and the other authors and contributors as well. I'll say we have a lot of comments and questions. So
I was reading through them, trying to
weed through
them.
I don't know So as I mentioned, if there are about OpenStax and technical stuff and how do I get to this and things those are extremely valid. We'll answer those, but we'll try to focus on when we have you two on regarding the questions that are about the coverage and the alignment and so on. So I don't know if it's best to kind of just scroll up and see, or if you just want to go through yourself, whatever's best for you.
Anthony, one of the questions that came up earlier was if we could give them an idea about what drugs are covered, particularly in the cardiac chapter and respiratory and diabetic chapter. And I think that it would be enough to show the table of contents.
Okay. So those, I'm sorry, I think I have.
And another question was, when do we expect the book to be published? And I believe it's going to be available was the target date in June? Yeah.
I think it'll be a little. I think June is on the outside. I think actually it might be a little before that. But yeah, that will be the latest. And again, everybody, you'll see, this draft is available, and you'll see it up. We'll keep updating it, and if anybody really does want it without the draft content note, we can provide it that way too. So it will kind of look like the final, but we like to keep that up to, especially on Pharmacology. We don't want anything in there that's not final. But in terms of showing the table of contents for those chapters, you said the I'm sorry, was it the
cardiac? I don't know if we got specific in the table of contents, but we did go to class, if I'm not mistaken.
Okay, let me get to that, and then
the cardiac and the respiratory.
Okay, so here we have the class.
Okay, so Is that helpful to the person who asked that question?
I can click the chapter. Well, hopefully it is, but again, if you really want to see it, I mean, I could go into it now, but I know we have a lot of questions too. Okay, I think so. Thank you. So one of the other um, questions, it came in on the Q&A side. Um, I don't know if what's better for Dr. Taylor or Dr. Paris to take this, but would it be feasible to say that this book could be used to guide nurse education graduate students in teaching the concepts of pharmacology? And feel free to say no if you don't think so. We're not overselling or anything like that. So just
I mean, I think it's like any pharmacology textbook. If you have a graduate student who's learning how to teach a topic, I hope that they're going to learn about that topic before they go teach it to other students. So I think, yes, it could be helpful that way. But it depends on how their class is set up. Are they going to be teaching mainly online, or are they teaching in person, or is it more of a hybrid type class? So I think that question's a little bit harder to ask than just a straight out yes or no to answer that. So Donna, any feedback as well?
No, I think you answered the question very well. I know that the focus when we wrote the book was as for a pre-licensure student. So, and I'm having trouble getting my questions to read. So I was going back to the question to make sure I understood it. Nursing education graduate students. I mean, I think I'm going to have to agree with Dr. Taylor on that. So.
And I've had graduate students in some of my courses before that come in and help teach, but again, we give them the topic and make sure that they know the topic before they actually go in. So I think this book can help them. It's made to flow very easily for students to understand. So even if it's a graduate student who hasn't taken pharm in 5 or 6 years, this should be a book that's well written, that they can actually grasp those concepts to be able to go in and teach the concept that they're assigned to.
That's great.
One of the questions was, are the textbook questions there? And they are. So all of the review questions have answers. Answers and a basic rationale.
There was another question in the chat about, would you consider the text to be concept based?
Honestly, I don't think it's more so concept based. It's kind of hard to make pharmacology text concept based. That would be more for your med surg or foundations type topics. I think pharmacology focuses more so on the pathophysiology of the disease processes and how we use drugs to treat those certain disease processes. I think it can be incorporated in with your med surg text as an adjunct type of reference whenever you are talking about certain concept-based processes.
And I completely agree. Yeah.
If it's okay, I'll answer a couple on the OpenStax side. Give you two a break for a second. You deserve it. So there's a question about updating. That's a great question. So we update pretty frequently on a book like this. It would be more often than others. If we receive any we have an open suggestion process. We accept suggestions from everyone. Every suggestion is reviewed. Not every suggestion is made. And there's two reasons why we wouldn't make, well, there's three reasons we wouldn't make it. One is if it's actually invalid or doesn't apply or maybe inaccurate. Two, if it's sort of beyond the scope of the course. Somebody's asking us, hey, you need to have 3 chapters. We're not going to probably make that change. And then, or if there's another reason that there's some other reason why it shouldn't be changed or it should be held for a revision. But if there's something where a drug classification is changed or a dosage is, we'll make that change. But again, it's not a wiki book. It will be addressed by faculty. Will weigh in on whether it's accurate and whether we should change it. That's the sort of everyday update. Doesn't happen every day, but it happens frequently. In terms of more robust revisions, akin to a textbook revision, second, third edition, that happens every couple of years. And OpenStax's policy on that is to do it when it's necessary. With a textbook like this, it would probably be necessary pretty often. A textbook like physics or calculus, very important courses, very deep value there, not as important to update those all the time, right? So there's just some differences in the scope of when we update, and we rely very heavily on faculty, the authors and contributors, and also the users to sort of inform that process about how much it needs to be revised, what's changed, and also sometimes we change in anticipation of something. If we know a new set of standards or drug classifications are coming out, we'll get ready for that and we'll do it as close to as possible. The same way in our American government book, there's an election coming up. We know that election is happening. We'll be ready to make the changes as soon as it happens. So we work with authors and contributors that way so that we can make updates all the time on time, essentially. There was one other question along these lines that I'll respond to. Can you take notes within the online format? Yes, you can take notes within the online format, highlight multiple colors and take notes, as can students. It does require a login to save your information. So instructors or students can create an account and log in and get that information. And get that access to make those changes. We don't. We'll be very careful with your information and keep it private and so on. That access will also, for the instructors, allow them to access the instructor-only resources. Students don't get access to those. Okay.
And then, Anthony,
go
I
ahead.
saw
Yes.
a question that was asked from an instructional designer. So as a nurse and as an instructional designer, the question was, are there competencies linked to OpenStax course content or specifically to the testing standards connected to the course content? So our questions and chapters are specifically linked to standards for nursing. So we connect to the ACEN Essentials. We follow NCSBN testing guidelines for NCLEX RN. And then we are also attached to the QSUN competencies.
One of the other questions was, is there a women's and a men's health section? And there is.
And as I think we're all doing, we're kind of scrolling through the chat and the Q&A, and I'm getting to some of those. So Alita asked a question about, and first of all, I had mentioned earlier in a session about how sometimes people take our books and use them to build other resources like H5Ps and videos, and Alita is on, and she has done that as much as probably anybody in the world. So we're so glad to have her on and asking this great question. So the question is, what are you doing to improve usability in other countries where there are differing legislations and governing bodies? I assume Alita's asking because maybe she's thinking of Canada, but other countries apply as well. Anything outside the US that either of you could speak to?
Yeah, so this book was mainly focused on US and FDA guidelines, and that was a conversation that we had early on. There's just so many regulations regarding pharmacology and medications across the world in general that there's no way to address each of those standards in different countries. So Donna, any comments on that?
There is a little bit of information about some of the Canadian standards, and especially as it relates to scheduled meds and that type of thing. I believe that's in chapter 1. I think I'm correct in saying it's in chapter 1.
We'll have to keep track of. It's a big book. Got one
Sorry.
baseline question about, can this textbook be customized to not include nurses in the title? Yes, actually it can. The credit would still have to go to the book itself, but if you wanted to change the title on the text. So OpenStax has various ways of customization. You can do it in the PDF, or we actually provide Word documents, and you can do it in there as well, or some other means. There is not an online drug handbook formally that comes with the book. I don't know if Dr. Terrell or Dr. Paris have any comments about how, even if it's one they have to purchase, like where there are any that align, or any recommendations on that front. And if you don't, it's fine, but just wondering.
Hopefully they won't need an additional drug book guide to go along with this book. Most of the drugs are covered in it. And like I said, they do follow the Daily Med FDA guidelines. And those are always updated frequently. And like I said, with this book, we were going back and making sure that we had the most up-to-date information. So I think the information's going to be there. I think most nursing schools do have online drug guides that they use, if I'm not mistaken. Donna, you're from Texas, so you want to speak to that?
I know we do.
I know in our school, we also use different textbooks. It just depends on the vendor that provides some other textbooks that are available to the nursing students for other topics that may not be covered through this OpenStax, this type of grant that they received.
Yeah, so if there was the ability to develop one, I would say, everything I just said about the now that we're answering questions, I hope it's okay. I'll come on video because I feel bad. We can't have every book, we can't do every resource. So the one thing about doing a drug guide, while it would be a great start, if we built it, we'd probably be very committed to updating that all the time. And maybe, we might be not be able to maintain all the books at once. So that's a consideration, sort of the long-term maintenance. But hopefully maybe we can get, you can use it without. We had a question about Xanadu custom publishing. It's a great question. So OpenStax works with Xanadu. That's actually the provider of our print textbooks. So that's how we do the printing. And Xanadu Custom Publishing does do a significant amount of custom publishing of OpenStax books across the spectrum. Our college success book, all the way to our physics book, and everything in between. And the same would apply here. They'd have the opportunity to do that. Now, Xanadu is already involved with nursing in Open because I believe they're the publishers of the printers of the OpenRN series. So there might be even opportunities to combine across the different series. We'd love to see that. It's up to you and up to the companies that be in those senses. But the textbooks themselves will be available, and I'm sure the Xanadu team will be interested in that process. Getting involved in there as well. Thanks, Amanda, for porting over some of those questions. Hopefully, we got to some of them. Got a question about QTI. Okay, so we will do our best to put things in QTI format. We aren't always able to do that. Sometimes we have to go into a new project to do that, but we will do our best. We understand the need and how it can be useful. Let's just see. Can you show the actual page for the beta? And yeah, so let me do that. Sorry, we're looking at a few different series of questions. So, okay. So Rita asked if we could show the beta blockers, for example. Let me go to that. So I'm gonna zoom out a little, so hopefully you can see a little better. And I'll just kind of, if it's okay, Rita, I will go through. I'll just kind of scroll down slowly so you can see what we have. So hopefully this is helpful. I know I'm scrolling a little faster now to see what's in this chapter for this book.
and I think we've passed beta blockers, but
Oh, sorry. Oh, I did. Sorry.
it gives you an idea about
Yep.
how the content looks.
Yeah. Yeah, and I should say for those from we're focused on pharmacology here, but for those who might be attending the session, but maybe you're thinking about the other books as well. There are. Oh, sorry about that. I did skip right past it. Every book there's a lot of similarities across the series, but they are individual textbooks. The authors for each book, just like Dr. Taylor and Dr. Paris were saying here, like took a deep look, went through their processes, debated, discussed, got feedback, and for all those books too. So you'll see a lot of similar features in the different client teaching guidelines is not in every textbook, but it's pretty consistent, and so on. Of course, case studies, unfolding case studies are, but the books are individualized. They're really meant to fit the course, just like Dr. Taylor and Dr. Paris are saying here. A lot of focus on these books themselves. We definitely let the individual needs of a course overtake the idea of a series being cohesive, so that it fit each course as needed. Just taking another look at the questions. Shelley asked if we were willing to change the naming of the infection to HIV rather than HIV/AIDS. That's one of those questions that we definitely take a very deep look at, and get faculty feedback on if it sounds like if that's the actual name, the accepted name, we should say it. And I will say, and not at all speaking for experts, but sometimes if there is if there is a term that is the better and updated term to use, we will use it. Sometimes we'll do something like on first reference, mention, hey, this previously might be used here. Often we'll do that because people might be using resources across different landscapes, and we want to use the correct terminology, but also acknowledge that not every site is updated every on time. So that's something we can definitely take a look at. Rita asked about taking the title out. I mean, yeah, if you, yeah, I mean, this is the opportunity of OER. You are able to take a change, but I think there's trade-offs. Whenever you, frankly, even if you customize any type of book, a commercial textbook, there's definitely going to be trade-offs in terms of customization and focus, even if you're just editing out certain terms or certain chapters or certain sections. And so on. So there could be downstream effects that can occur. And there's also, I would say, the opportunity. Customization isn't just changing or removing; it's also adding. You've probably seen this in custom in with commercial textbooks too. Putting class notes or other course materials at the front of a textbook or at the back of a textbook. You could unify things in that way with OER as well, or you don't have to. You can put it, you could use your LMS for that or some other environment. But that again is something that maybe like a Xanadu or somebody else can help with. Just as a logistical thing, we have some time left, but just a logistical item. So we are going to be starting our next session. I'm going to stop share for a second. We're going to starting our next session in a little bit. Technically, actually, so we're kind of going a little long here, and thank you, Dr. Paris and Dr. Taylor, for doing it. But our next session is going to be on the maternal newborn nursing book, and Amy Giles and Laura Wallace are going to be sharing on that. That will start at 1 Eastern, 12 noon Central. So at noon Central, we'll start that. We are still on this Zoom. They're two separate Zooms. So like if we for some reason are keeping going on this, we could shift. Other folks can shift over there. But we'll be starting that in about 5 minutes. Any final comments or questions that you or comments that you want to make, Dr. Paris or Dr. Taylor?
It's been a great experience, and I hope you enjoy the book.
Oh, that's great.
I agree with Dr. Paris. It was a great experience collaborating with the other faculty members and PharmD, and just this book was so interprofessional, which was kind of very nice for us to experience with writing a book versus just experiencing that daily at the hospital setting. So it was very nice.
I agree.
Thank you so much. Well, thank you. Thank you all. Thank you all for attending. As we've mentioned, the sessions are all recorded. They'll be shared out on the OpenStax YouTube channel, and then through other means, we'll be, sharing it through OER Texas that we showed before, and so on. And if you have any questions, you can continue to get back to us, info@openstax.org. And just so you know, if there are any specific questions that come in our way about the coverage and things like in the book that you don't think somebody like me could answer or something like that, we'll definitely pass on the questions and get the answers as best we can. I want to say thank you so much. This is our first book specific session of the event. I think it went so well. Thank you both so much, Dr. Paris and Dr. Taylor, for your contributions. Thank you everybody for joining, and thanks for all the great questions and comments and support. Really eager to see this book get used. We'll be sharing more about it, and in about 4 minutes now, or maybe a little less, we'll start the maternal newborn nursing session. So thank you all so much, and have a great day.
Thank you.
Thank you.
Bye.